Hi, my name is Dr. Pradeep Porwal, and in this section we will be seeing how we can do a proper screening of a patient and how to do a complete assessment of fall. Thank you.
So let us start the screening and assessment of vestibular patients. So we will be talking on two things. First is how we will screen the patient, that is the functional ability of a patient, and we will be using two criteria. First one is composite physical functional scale, and the second one is stay independent, and we have a wildcard entry at third also. And next we will see how we will completely assess or how to do a fall risk assessment. So we will be using Fullerton Advanced Balance Scale, Berg Balance Scale and other tests. So coming to the first thing is screening a patient. So starting with composite physical functional scale. So in this scale we have 12 different questions, and if the patient is able to do, we have to give a score of 2. If a patient can do but he needs some help, we will give the score of 1, and if patient is not able to do, then we will rate them as 0. So the first question is, can he take care of own personal need like dressing himself? If he is able to do, then we will write the score of 2, and so on. So the next question is he able to take bath or use tub? Third is, if he can walk outside like 1 or 2 blocks. Fourth is, if he can do light household work like cooking, washing dishes. And the fifth one is, if he can climb up and down the stairs. Next is, if he can do little bit of shopping like getting milk or getting eggs, like approximately walking for at least 100 or 200 meters. If he can lift and carry 10 pounds like a bag of groceries, then can he walk half a mile, can he walk 1 mile, and can he carry a heavy suitcase, and can he do the heavy household activities like cleaning the floors, using vacuum and other things. And the last is, can he do strenuous activities like hiking, digging garden, moving heavy objects, etc. So if the patient is able to do all these 12 activities and the score is 24, then the patient is high functioning patient or a normal patient. If he is able to do only 7 of those things, the score of 14, then the patient is moderately functioning. And the third, if he is not able to do 7 things or the score is less than 14, then the patient is at risk of fall. So this is a very easy test which you can do. Coming to the next part, that is stay independent. It is by CDC. So again we have 12 different questions. So the patient have to fill. These are the questions given, and they also have given different numbers. So number 2, 0, 1, etc. And they have also mentioned why these particular questions matter. So let us start the first question. So patient have to answer this question: I have fallen the past year. And remember, note that for these two questions the score is 2. So the first question is, if he had a fall in the past year. If it is yes, then the score will be 2, and if no, then the score will be 0. And why it is important? Because patients who have fallen once are more likely to fall again. Okay, so coming to the next question, are they using any cane or walker? The reason is because the patient who are using or who are advised to use a cane or walker are more likely to fall. Again, the score is 2. So these two questions have the highest score. The other questions are, sometimes I feel unsteady when I am walking. You can look or you can download this particular PDF from CDC website. You can directly write STEADI and CDC on Google and you can download this particular file. So I will be going to the next question. I am steady myself but holding on to furniture when I am walking at home. Then the score is yes. If a patient is worried about falling, again the score is yes. I need to push with my hands to stand up from a chair. Again the number is 1. I have some trouble stepping up. The score is 1. I have to rush to the toilet. Next, I have lost some feeling in my feet. And this numbness can be a sign of neuropathy, polyneuropathy, or like there are many differentials for those neuropathies, so I will not go into detail. Next is I take medicine that sometimes make me feel lightheaded or more tired than usual. Next is I take medicine to help me sleep. And the last question is I often feel sad or depressed. So if you look at these questions, you can also understand that if this patient is having other comorbid conditions also, like a patient is suffering from diabetes, or the patient is suffering from BPH, that is benign prostate hypertrophy, or you need to refer this patient to a psychiatrist or to a orthopedician. So this scale is actually very good, and this is my personal favorite to screen the patient on the first visit. So again, it has 12 questions, and if the score is more than 4, the person is more likely to fall. Moving to the next. The next is hospital anxiety and depression scale. Most of our patients generally have a little bit of anxiety or a little bit of depression or other symptoms including vestibular disorders plus diabetes or hypertension, and generally they don't get a proper diagnosis of vestibular or the vertigo. So that is why they have a little more anxiety, which we have to take care, which we have to actually look. So this questionnaire is actually very helpful if you are suspecting that a patient is suffering from a functional dizziness or a patient is suffering from anxiety or triple PD. So let us see what are the scores. So you can see that in this questionnaire they have given A and D. There are two different names, A and D. So the sections which have A are mainly for anxiety related disorders, anxiety related questions, and D stands for depression. So these questions are mainly focusing on the depression part. So the instruction will be they have to fill immediately, like whichever thing comes to their mind, they have to mark it. So the first question is, I feel tense. So the first option is most of the time, a lot of the time, time to time, occasionally, or not at all. So if this feel that they are tensed, which can be due to anything, so they have to tick this particular answer. Then I still enjoy the things I used to enjoy. Definitely as much, not quite, only a little. So they have to mark the answers. Next question is, I get a sort of frightened feeling like something awful is going to happen. So this is again a very good question related to anxiety, and the most of the patient will tell us that, doctor, I don't know what is going to happen with me, and the most common fear is fear of fall, and then due to fall I might die also. So fear of fall and fear of death. So these things are also majorly found in our patients. So it is better to ask the patients to fill up this particular form. So I have lost interest in my appearance, definitely. So they can take the relevant questions. So next is, I can laugh and see the funny side of things. Yes, not quite, definitely not so much now. So they can tick the different answers. And in the end, you will get 3 different types of scores. So the first type will be in the A questionnaire, the A part, you may get a score of more than 8. So this means that a patient is more anxious. Second part or second type of result which you can get is the patient is feeling the score is more than 8 in the depression part. Then you can say that the patient is suffering from more or less depression. Third variety which you can get is a score of 12, which is a mixture of A and D. Then you can say that this patient has significant psychiatric symptoms, and in this case we have to refer the patient to a psychiatrist. So this is a very good scale which you can use if you are suspecting anxiety or depression in your patients. So moving on to the assessment part. So we will be talking on Fullerton Advanced Balance Scale, which is very good. Second is the Berg Balance Scale. The third is a Senior Fitness Test. So you can download by just typing the name, or you can scan the QR code also if you are watching from your laptop or desktop. So let us start. So we will ask the patient to stand with feet together and eyes closed. So we will give a score of 0 to 4. 0 if the patient is unable to maintain the standing position independently. So we will give the score as 0. If the patient is able to maintain the position but he is unable to keep the eyes closed for more than 10 seconds, the score is 1. If he is able to maintain the position with eyes closed for more than 10 seconds but less than 30 seconds, the score will be 2. And the score will be 3 if he is able to maintain the position for 30 seconds but require close supervision. And 4 is normal, like the patient is able to maintain the position for 30 seconds. So what does it mean? If the patient is having a score of 0 or 1, we can assume that he is not able to stand properly with the eyes closed. So this patient might have a reduced center of gravity or reduced proprioception or a weak hip adductor and abductor muscles. So just by looking or analyzing a particular test, we can see what we can do with this particular patients. So we have to strengthen, we have to give the exercise which are mainly targeted on COG, that is center of gravity. We have to give something for the proprioception, and then we have to give him hip exercise. Okay, so coming to the next thing. So the doctor is standing with a pencil on his hand, and the patient has to reach forward with the arms and take the pencil. If the patient is unable to reach the pencil without taking more than 2 steps, the score is 0. If he is able to reach but he takes 2 steps, the score is 1. Next is, if the patient is able to reach the pencil and take 1 step, the score is 2. And if he is able to reach the pencil without moving the feet but requires little bit of supervision, the score is 3. And if he is able to reach without moving the feet, the score is 4, and it is normal. So what does it mean? Again, it means that the patient has reduced ankle range of motion because he is not able to lean forward and he has to take few steps. Then the patient might have fear of fall. That is why he is taking additional steps. Or third will be the patient might have lower back muscle weakness. Okay, so going to the next one. Then we ask the patient to turn 360 degrees in both the direction, so clockwise and anti-clockwise. If the score is 1, he needs close supervision or verbal cueing while turning. The score of 2 is when he is able to take a turn but takes more than 4 steps in both the direction, more than 4 steps. Normally we take 2 or 2.5 steps. Then if a patient is able to take a 360-degree turn but unable to complete in 4 steps or few in one direction, the score will be 3. And fourth will be patient is able to take 360-degree turn in both the direction by taking less than 4 steps. So what does it mean? It means that there is poor dynamic center of gravity control. The patient might have fear of fall, or more likely the patient is actually suffering from vestibular dizziness, or more precisely one-sided vestibular unilateral hyperfunction. So the patient will able to do the right side turn completely, but he is not able to do it by taking less than 4 steps in the other side. So these few steps, if we record, if we watch carefully, we can easily target the therapy also. Like we have to do this particular exercise for this patient. Coming to the next part. So we ask the patient to step up on a 6-inch bench. So there will be a 6-inch small stool or table kind of a thing, and then the patient have to stand on it with the one leg, or he has to put his first leg and then remove it back. The score is 0 if he is unable to step up on a bench. The score is 1 if he is able to step up on the bench with the leading leg, but the other leg contacts the bench or touches the bench or swings around the bench in both the direction. The score is 1 if he is able to stand with the leading leg but the other leg touches it in one direction or swings in one direction. The score is 2. The score will be 3 if he is able to complete the step without any with a close supervision. Then the score is 3, and if he is able to correctly complete without any supervision, then the score will be 4. So it gives us that if the reading is 0 or 1, the patient might have reduced range of motion at ankle, hip, knee, and poor control of the center of gravity and lower limb weakness. Then we will ask the patient to do a tandem walk. If he is able to complete the 10 step with more than 5 interruptions, the score is 1. If he is able to complete 10 step with 3 or 5 interruptions, the score is 2. If he is able to complete 10 steps with 1 or 2 interruptions, the score is 3. And 4 if he is able to do it all alone. If the score is 0 and 1, again we can see that this patient might have a fear of fall, or the patient has poor dynamic control of center of gravity control, or the vision might be impaired. Next, we ask the patient to stand on one leg. So I will not go into detail, but if he is unable to maintain the position for more than 5 seconds, then we can say that he has poor dynamic center of gravity control. The vision might be impaired and he might have fear of fall. Coming to the next one, we ask the patient to stand on foam with eyes closed. If he is unable or unwilling to close the eyes, or if he is unable to maintain the position with eyes closed for 10 seconds or less, then we can say that this patient might have a low vestibular input, or the patient has fear of fall with closed eyes, or the patient might have a neuropathy, which could be a peripheral or a central neuropathy. Next is we ask the patient to jump with both feet. If he is unable to jump, or one foot leaves either early or leaves late, then we can say that there is poor dynamic control of center of gravity and there is weak lower body and upper body muscle coordination. Next is we ask the patient to walk with right head turn and left head turn, and the turn should be more than 30 degrees, and the patient have to walk 10 steps. So if he is unable to walk 10 steps, or if he is unable to maintain the 30-degree head turn, then we can say that this patient might have a poor dynamic central of gravity control, or there might be a low vestibular input, or vision might be impaired. In the last test, we actually push the patient from the back, and if he is unable to maintain the balance and he has to take 2 or more steps to stand up correctly, or he is not able to maintain the balance, we can say that the center of gravity is not that much good, and upper body and lower body muscle needs to be strengthened. So the maximum score is 40, and score of less than 25 means that this patient is at high risk for fall. So what inference we can make? If the hip adductors or abductors are weak, we can give him lateral weight shift against resistance exercise and side leg raises against gravity or resistance. If there is poor central of gravity control, then we can give him seated or standing balance activities. So I will be talking on these exercises in the next section. If there is poor use of somatosensory, then standing balance activities with eyes closed, with sways to front and back and lateral side, we can give. For reduced ankle range of motion, we can give him ankle exercises. For fear of falling, we can give him confidence building activities, and we can actually place a mirror in front of which the patient can stand, and he can get a real-time feedback that okay, I am able to do it now, next time also I can do it. So this can-do attitude will also build up, so the confidence will build up. If the lower body muscle weakness is there, we can give him wall sits and exercises related to lower body muscles. If the patient has poor vestibular impairment, then we can give him gaze stabilizing exercises which involves head and eye movements. If the patient is having poor vision, then we can refer him to my ophthalmologist and again give him a gaze stabilization exercise. So next is Berg balance scale. It is very similar to the previous scale. So it has total 14 steps, and the maximum score is 56, and a score of less than 45 means that the patient might fall again. So you can download it by the QR code, or you can directly search for it on the Google search engine. Now coming to the last one, the senior fitness test. This is very good, very excellent, very short. You can do this particular thing in I think less than 10 minutes. So let us see what are the components. So the first thing is we will ask the patient who is sitting on a chair to curl their arms like this, and then they have to stand and then sit again. So we will record how many number of full stands he can do within 30 seconds. So it's very easy. There is a chair. We ask the patient to stand and sit, how much fast he can do within 30 seconds. So if he is able to do 8 or more than 8 stands, then the patient is normal. What is the inference? Inference is the lower body strength is good. Okay, so coming to the next part, this is arm curl. So again, we will ask the patient to do we will ask the patient to lift a weight and do an arm curl. So for men, we will give him 8 pounds, and for women, we will give 5 pounds of weight, and we will see how many number of curls he or she can do in 30 seconds. So if they are doing it less than 11, then we can say that the upper body strength is not proper. And what will be our therapy? We will start giving him the exercise is for upper body strength. Next is we will ask the patient to stand and lift up their leg, once right leg and in the other part the left leg, so that it will be reaching each knee to the midway between patella and the iliac crest. So normally what we say is we ask the patient to do a marching kind of activity, and we have to record how much he can do within 2 minutes. And if he is taking less than 65 steps in 2 minutes, then we can say that the aerobic endurance is very less in this particular patient. Then we ask the patient, from the sitting position they have to touch the tip of the toe of the right side of the leg, right leg or left leg, and we will measure what is the distance between the hand and the tip. So if it is 4 inches or more in male or more than 2 inches in female, we can say that the lower body flexibility is not that much good. Then the second last is we will ask the patient to do a back scratch, and we will again note the distance between the two hands. So if it is 4 inches or more or 2 inches or more for females, we can say that the upper body flexibility is less. And the last will be, we will ask the patient to stand from a sitting chair, go to walk 8 feet, turn, take a 180-degree turn, and then go and sit. So we will see if he takes more than 8 or 9 seconds from sitting to again sitting position, then the agility or the dynamic balance is not good for the patient. So this was the screening and assessment part for vestibular patients. Now this section is complete.